Welcome to this foot and ankle patient education series. My name is Hisham Shalaby. I'm a foot and ankle and limb reconstruction surgeon in Edinburgh. This video is about hallux valgus or bunion deformity, the surgical correction. This is a typical X-ray of a hallux valgus deformity. The deviation of the big toe causes the bone on the inside to be prominent, and that usually rubs against the shoes. The deviation of the toe as well causes overcrowding, and usually we can get overriding or underriding of the second toe. The tight, soft tissues force the big toe to the deformed position. The operation is done as a day case under general anesthetic and nerve blocks. We start with a small incision in the first web space to release the soft tissues. Then we do another incision on the inside of the big toe. Through this incision, we trim the bunion and we perform a Z-shaped break in the first metatarsal. We then translate the bone laterally to reduce the width of the forefoot. We fix the bone with screws and remove it. We then remove a small wedge of bone from the proximal phalanx. And this allows us to realign the big toe. The bone here is also fixed with a small metal staple, and this restores a perfect alignment of the big toe and also reduces the width of the forefoot. After the operation, the patient is reviewed by the physio and given crutches if needed. The patient is also given a 4-foot offloading shoe to allow them to take the weight through the heel. Post-operatively, we instruct the patients to keep their feet elevated to reduce the swelling. We also ask them to drink plenty of fluids and to do some respiratory exercises. At 2 weeks, the sutures are removed and the dressings are reduced, and at 6 weeks, the patient come again for an X-ray to check their progress, and they're usually discharged if they're doing okay. The swelling can last for a while after this operation, generally going on and off, but ultimately fading away. The risks of the surgery include sensitive and painful scars, injury to a small nerve on top of the big toe that can leave the toe with some numbness, joint stiffness, undercorrection and overcorrection, and a very slim risk of infection. There are certain groups of patients who are at a slightly higher risk of complications. These mainly include patients who are smoking, diabetic, on steroids, or on blood thinning medication. This is how the X-rays look after the operation, and we can see here the correction and the fixation. Thank you for watching, and for more information or to book an appointment in Edinburgh, please visit my website orthopedicworld.com.